Anthrax. Anthrax has been known since ancient times as one of the diseases that affect humans and animals. The main danger lies in the ability of anthrax spores to attack biological organisms. Anthrax is a difficult disease that affects the respiratory system, and its symptoms appear after inhaling the spores. The disease is caused by the anthrax bacterium when it does not receive enough food. This bacterium transforms into a spore, meaning it becomes inactive and cohesive and has the ability to survive in soil and water. For a very long time, this disease has been described in various places in the world, and it is known that if it penetrates the body, it germinates and turns into germs. These germs secrete 3 types of toxins, which cause the disease. Symptoms of anthrax. The most prominent symptoms of anthrax include: 1. Symptoms of injectable anthrax, detected by injecting illicit drugs. The initial signs and symptoms include redness in the injection area, significant swelling, shock, failure of many body systems, meningitis. 2. Symptoms of inhalation anthrax. Inhalation anthrax develops when the spores are breathed in or inhaled. Inhalation anthrax is the most lethal form of the disease and is often fatal even with treatment. Initial signs and symptoms include flu-like symptoms for a few hours or days, such as sore throat, mild fever, tired, muscle pain, mild chest discomfort, shortness of breath, nausea, coughing up blood, painful swallowing, high temperature, difficulty breathing, shock, meningitis. 3. Symptoms of gastrointestinal anthrax. Gastrointestinal anthrax infection results from eating undercooked meat from an infected animal. It can affect the digestive system from the throat to the colon. Signs and symptoms include the following: nausea, vomiting, stomach ache, headache, anorexia, fever, severe bloody diarrhea in the late stages of the disease, sore throat and difficulty swallowing, neck swelling. 4. Symptoms of cutaneous anthrax. Skin anthrax infection enters your body through your skin, usually through a cut or other sore. Rarely, cutaneous anthrax is fatal. Signs and symptoms include raised, itchy bumps resembling an insect bite that quickly develop into a painless sore with a black center, swelling of the ulcer and nearby lymph nodes, flu-like symptoms including fever and headache. Causes and risk factors of anthrax. The following is an explanation of the most prominent reasons and factors. 1. Causes of anthrax. The disease is caused by Bacillus anthracis bacteria. The bacteria can produce spores that can live in the ground for years. Wild animals, such as deer, cattle, or sheep, can also inhale or ingest inactive spores while grazing. After mixing with bodily fluids, anthrax bacteria become active, multiply, and spread throughout the body, where the bacteria cause a toxic and fatal reaction. The same process occurs for people who inhale, swallow, or come into contact with the germs. Infection with the disease in the natural state is common in animals that feed on grass, and that ingest or inhale spores from the soil. The infection is transmitted to humans when they touch the corpse of an infected animal, or when they touch the products of these animals, such as their skin, fur, or wool, as direct contact may cause skin anthrax appears, while eating its meat causes infection in the intestines. 2. Anthrax risk factors. The most prominent risk factors include the following: handling animal skins, fur, or wool in areas where the incidence of anthrax is high, working in veterinary medicine, especially if you work with livestock, being in an area with a high risk of anthrax, injecting prohibited drugs, such as heroin. Complications of anthrax. The most serious complications of anthrax include the following: the body's inability to respond to the infection normally, leading to damage to multiple organ systems, inflammation of the membranes and fluid covering the brain and spinal cord, leading to severe bleeding, hemorrhagic meningitis, and death. Diagnosis of anthrax. Anthrax is diagnosed when bacteria are present in the blood, skin lesions, or respiratory secretions when tests and examinations are performed. It can also be diagnosed by measuring certain antibodies in the blood of infected people. Nasal swabs are not a good way to diagnose anthrax, because a swab cannot conclusively determine whether a person has not been exposed to anthrax. The most prominent diagnostic methods include the following. 1. Skin test. A sample of fluid from a suspicious lesion on the skin or a small sample of tissue. Biopsy may be tested in the laboratory for signs of cutaneous anthrax. 2. Blood test. A small amount of blood may be drawn and examined in a laboratory for anthrax bacteria. 3. Radiography, such as a chest X-ray or CT scan. Your doctor may order a chest X-ray or CT scan to help diagnose inhalation anthrax. 4. Stool test. To diagnose gastrointestinal anthrax, your doctor may test a stool sample for anthrax bacteria. 5. Lumbar puncture. In this test, your doctor inserts a needle into your spinal canal and withdraws a small amount of fluid. A spinal tap is recommended anytime doctors suspect systemic anthrax because of the possibility of meningitis. Anthrax treatment. Medical treatment for anthrax is divided into preventive treatment and treatment of the effects of the disease upon infection, where antibiotic treatment is used for those who have been exposed to the germ without causing the disease. There are several antibiotics that are used successfully to treat anthrax, with treatment being very effective in cutaneous anthrax and effective in inhalation anthrax, and in gastrointestinal anthrax if started early in the course of infection. These treatments prevent the disease from appearing, and this treatment is given to the infected person over a period of 60 days, or until immunity, or physical immunity is established through active vaccination. Antibiotic treatments are also used to treat those infected with the disease and who have symptoms, and treatment is usually received in the hospital. Anthrax prevention. The appropriate vaccination serum against the malignant bacterial disease is available, and vaccination is done by injecting 3 doses given, while maintaining an interval of 2 weeks for each dose. Then this is followed by receiving 3 additional booster or stimulant serum injections at a frequency of 6 months between each injection, as this vaccination is considered safe with no side effects. To prevent infection after exposure to anthrax spores, the following steps can be followed. 60-day treatment with antibiotics, which include ciprofloxacin, doxycycline, and levofloxacin for adults and children. A series of 3 doses of anthrax vaccine. Treatment with antibodies, such as raxibacumab endobiltoxaximab. Common types. The most common types of anthrax include 1. Cutaneous anthrax. 95% of anthrax cases in humans rise naturally. The period of infection lasts from 1 to 6 days and causes effects on the skin that resemble a burn, with a black scab in its center. The scab falls off after a week, leaving a scar in its place. Cutaneous anthrax is diagnosed by identifying bacteria that are identified by culturing a biopsy taken from the site of infection. 2. Intestinal anthrax, also known as intestinal anthrax. When the disease begins, the patient experiences nausea, vomiting, abdominal pain, fever, and diarrhea with bleeding. The patient's condition may deteriorate if he does not receive treatment containing appropriate antibiotics. 3. Pulmonary anthrax. Pulmonary anthrax is similar to the symptoms of the disease at the beginning of an influenza infection, which affects the body with shivers, weakness, muscle pain, coughing, and sometimes a feeling of tension in the chest. After 2 to 5 days of these symptoms, the second stage of the disease begins, which is a difficult stage as it develops in 50% of those infected with encephalitis.